Hello viewers, Assalamu alaikum. Myself, Dr. Tamana Mahmood Umi. We are here with the 864th episode of Medi Live, and our sponsor today is Catalysis, and our knowledge partner is Kikatrix. We all know that we are in the COVID-19 era, and in this pandemic situation, hope you all are doing well. And we are now today we are going to discuss about acne scar treatment, and this is our main topic today for discussion. And for this discussion we are very much happy we can manage to Dr. Abu Jafar Md Shahidul Hoq, who is assistant professor cosmetic dermatology and laser specialist, Bangladesh. So assalamu alaikum, hope you are doing well. Assalamu alaikum, sir.
Walaikum salam.
Can you hear me, sir?
Yes. I do hear you. Can you hear me? Am I audible? Hello?
Yes, sir. You are audible. Now we can hear you. You are audible,
Okay.
sir.
Okay, thank you.
How are you, sir?
Alhamdulillah, I'm fine. How are you?
Okay, Alhamdulillah, I'm also fine, sir. In this COVID era, we all are trying to be fine, in fact. And today we are going to discuss about acne scar treatment, and this is a very common topic, I think. And dear viewers, for your concern, I'm telling that we are live on Facebook and YouTube, and our comment box is open for you. You can ask any question, any of your queries in the comment box. So please stay with us. Sir, I want to know at first that what is acne? What do we mean by acne? As a specialist doctor, how can you define acne?
Acne is a inflammatory lesions involving the pilosebaceous unit. Pilosebaceous unit is composed of um, sebaceous gland, hair follicles, and it is presented as papules, comedones, pustules, and involving the some specific predilection site like the face, chest, and back of the chest, and deltoid region. And it is most common in the teenage group, especially the 13 to 21 year of age, and most commonly affects the male, but the females are more concerned about this, so they come to our practice day to day. So but we may think that female is most predominating, but actually it is almost same for the females and males, but the female are concerned due to the some beauty concern, so that come to our chambers and hospitals. So we think this is more common in female, but actually this is normal for both male and female.
Yeah, this is a very important information that both males and females are commonly affected with, equally affected with acne, and they both need treatment, and they both have to be careful about developing acne. So, sir, in this point, I want to know that what are the causes? What are the causes of development of acne?
Thank you. It's a nice question. Acne is a very multifactorial disease. A lot of etiological factors plays role into the causation of the acne. The most important is the androgen hormone, because it is a disease of the adolescents, and when the androgen hormone is predominating, and besides this, a lot of factors like emotional stress and endocrine other endocrine problem like polycystic ovarian syndrome, some drugs, and some cosmetics, behavior, to some extent diet also contribute to this causation of the acne vulgaris. At the same time, other disease, and especially what we now getting more frequently is that the people are using some outdated and off level medication, especially the steroid hormones for the whitening of their skin, and that's the one of the important cause. Now we are getting the people suffering from acne, and this is one of the important cause of acne, for especially for the young ladies who are very much interested to make them to make their skin white, and that's why they are frequently using the steroid. And this is now very commonly we are getting about the causation of the acne, especially the young girls.
Thank you very much, sir. We have learned more about the causative factors of development of acne, and as you have said that polycystic ovarian disease nowadays is a very common phenomena in the young ladies. So, what will you tell about this polycystic ovarian syndrome or disease?
Actually, patient of this kind patient are have some other problem, especially the menstrual problem. They are amenorrheic, and at the same time they have got some other problem like they are obese, they have got hirsutism, and they have got acanthosis nigricans, especially the blackening of the skin folds. And this kind of patient have presented us with severe acne associated with this the all this the problem what I told just now, like hirsutism, acanthosis nigricans, and obesity, and more importantly, the abnormalities in the menstrual cycle.
Thank you very much, sir. Dear viewers, for your concern, for your knowledge, for your information, I'm telling you that we are discussing about acne scar treatment today. So please put your queries about this discussion topic on our comment in our comment box. Uh, who are putting your questions about other than our discussion topic today, we can't take their questions. We are very sorry about that. So please put your comments, put your queries about our discussion topic, acne scar or acne vulgaris, acne treatment, any type of questions you can put, and we will try to answer you. Sir, if I want to know that what are the clinical features, already you have told some of the clinical features, but what are other clinical features of acne and what are the types of acne actually?
Actually, acne is categorized by different ways. Some are mild, moderate, severe. This is one of the way of categorization. Or and at the same time, we can get some other presentation like papules, pustules, comedones, nodules, cysts. Even we get some ulcer, so like this. Actually, the center of main component of the disease is the comedones, and comedones may be the open comedon or closed comedon. An open comedon is basically looks white or yellowish in color. Uh, Closed comedon is basically white or yellowish in color, but open comedons are black in color. This is the mild form, but whenever it is associated with some pustules, then we call it more moderate. And when we get it, when it is associated with some nodules and cystic lesions, we call it severe form of acne. But uh, a lot of classification, a lot of classification are written in different books and with different journals. But this is simplest way to way that we can categorize, and this is the this categorization is important for the treatment purpose, because in case of a mild case, the treatment is in one pattern. In case of moderate, is another way of treatment, and in case of severe case, another way of treatment. But the presentation is that the people of different category patient come to us, and some people only come with papules or comedones, but in some cases unfortunately they come when there is already formation of the scar. And but unfortunately in some cases we on the other hand we get the hypertrophic scar, like a keloid and some hypertrophic scar like this. So presentation may be different, and so according to the condition, we get different type of presentation. If the patient comes early, then we get some papules, nodules, something like this. But in case of if the patient comes later with complication, then we get cystic lesion, at the same time scar or post-inflammatory hyperpigmentation, something like this. Thank you.
Thank you very much, sir. After yeah, whatever the stage is, after coming to you, patients presents with several signs symptoms, and I am sure that there are some several investigations that would help you. So I want to know that investigations, what that should help you in case of diagnosis of types of acne.
Actually, for the diagnosis of the acne, we don't know, we don't need any investigation. But investigation is the cause is to evaluate the cause of the acne, and at the same time for the treatment purpose. The investigation like CBC, some endocrine problem, we do ultrasonography of the whole abdomen to evaluate the polycystic ovarian syndrome. At the same time, we do some liver disease, liver investigation like a GPT and fasting lipid profile for the treatment purpose in the later on. At the same time, we take some we take history of either patient is pregnant, married or not. In case of pregnancy, in case of marriage, the pregnancy concern, because later on, if we want to prescribe some retinoids, in that case, the pregnancy history and pregnancy evaluation is also important for the treatment purpose. But the main thing is that for the diagnostic purpose, we don't need any investigation, but need investigation is for the etiology and for the later on for the treatment purpose.
Thank you very much, sir. We have some comments. Our viewers are with us. Thank you very much, viewers, for questioning in our comment box. Ajay is questioning: is glutathione safe for skin whitening, sir? What did you say?
Yeah, glutathione is one of the important medication we are using, and at the same time, other dermatologists, our colleagues, seniors and juniors, all are using. But it can be used, but under the supervision of a specialist dermatologist, because it has got some other side effects. Because if we use it long term, so it can be used, but with under supervision of some specialist qualified dermatologist.
Hope that you have got your answer, dear Ajoy. Munni and Shudipa Dasjipa has same question, same type of question. That is about the oil control. They both of them has oily skin and they are facing some pimple or acne problems. So they want to know about the oil control procedure. What would you say, sir?
Actually, well controlled oil is produced by the sebaceous gland, and the activity of the sebaceous gland itself, and at the same time using of other emollients from outside, all this contribute to the oiliness of the skin. First of all, we have to stop the using of outside some medications, especially oil, olive oil, some pomades like this, and at the same time, we can reduce the oil secretion by controlling the activity of the sebaceous gland. Sebaceous gland activity can be controlled by frequent washing of the face and keeping the facial area and scalp area dry and clean, and at the same time, sebaceous gland suppressing agent like isotretinoin can be used for the control of oiliness of the skin.
Hope that you both of you have got your answer, dear viewers. Please stay with us because we have some other important topics to discuss with you. Al Noman has a question. Acne mainly affects boys and girls between the ages of 15 and 18. Can it be treatable if left untreated? According to the age of hormonal changes, uh, uh, according to the hormonal changes, he want an answer from you. According to the age of hormonal changes, what are the effects, and if it's untreated acne, what are the complications? This is a very important topic. Thank you very much, viewer. You have put a very important topic. Sir, please answer.
uh, 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 Acne complication is very important, because treating not treating any disease in any right time is very dangerous for every disease. Uh, Same is for the acne treatment, because acne, if we don't treat, it can develop acne scar, and acne scar is very difficult to treat. At the same time, if acne is not treated in the right time, it can cause post-inflammatory hyperpigmentation. All these are very difficult to treat, because face is the index of the mind. Anybody likes a person by looking at the face. So this is very important, and right time treatment, if we don't get, so that can cause this kind of problem, and patient may be morally down. The patient be morally down, and he lost his interest for everything, because the face is the index of mind. So, so the right treatment
And
in the right way is very
they are
important.
very much depressed, irrespective of
Depressed,
age.
yes, yes. So this should be treated rightly, I think, because already if there is scar formation, I have told just earlier, if there is scar formation, it's very difficult to treat, very difficult.
Right, right. So, if I want to know the causes of scar formation, when the scars are formed, scars or pores, when they are formed in case of acne, what would you say, sir?
Acne scar is found basically not treated properly, maltreated. All these contribute to the formation of the scar, because sometimes the comedones, when it is not properly treated or treated by some inexperienced person, it causes injury to the skin, and at the same time epithelium and dermis, all these are injured, and so there is a scar formation. One is, at the same time, when it is that the condition is grievous, that is a severe form acne, if it is not properly treated, then cause injury to the epidermis, dermis, and so all these contribute to the scar formation. At the same time, some injudicious use of the instruments, especially the beauty parlor, who are not so much trained enough as they should be, this is one of the important cause of scar formation. So, in conclusion, we can say about the scar formation is the improper treatment, delayed treatment, and inexperienced manipulation of the disease.
Right, sir. Very rightly said. Most of our viewers, most of our people have a very important initiative for whitening of their skin, and fairness creams containing steroids. They are using that, and indiscriminate use of cosmetics and whatever you have said about the parlor. So these are the common causes for development of acne scars, and I should say that maltreatment and unscientific treatment is also a very common cause for development of acne scars. So if I want to know, sir, that what are the treatment procedures or treatment options in case of acne scar, what would you say, sir?
Uh, Acne scar, the treatment of acne scar is the first of all, we have to stop the eruption of the acne permanently. Then, then the residual scar should be treated by different ways. One of the important is the some silicone cream like cicatrix scar cream. This can be used. At the same time, we have a lot of treatment options like
That
chemical
is the
peeling.
knowledge partner of our episode today.
Yes, yes. Cicatrix cream is a silicone-based cream. It can remodulate the scar. At the same time, we have got some chemicals like glycolic acid, salicylic acid, uh, benzyl peroxides, and at the same time tricyclic acid, acetic acid. All this can be used. At the same time, we have got some laser treatment, ablative and non-ablative laser. At the same time, we have got microneedling, and all this can be used. And the latest, we are using this in combination, like microneedling with PRP, and laser with PRP, and some silicone based cream with PRP. PRP is now is important in
So
invention
what
in the
is
treatment of
PRP? What
acne
is
skin.
PRP, sir? If I want to
The
know for my
platelet,
viewers.
the platelet-rich plasma. Platelet plasma, actually it is gathered from the blood. Blood is taken out from the body, and it is centrifuged in the centrifuge machine. And then then plasma is platelet-rich plasma is ready, and it is infused in the scar. And at the same time, some stimulant like microneedling, and microneedling is in the form of derma roller and a radio frequency machine. So both these stimulate the collagen and elastic fiber. All these things helps to remodulation of the collagen tissue, and skin tightening occurs. And as skin is tightened, so scar is less thin. But the treatment depends upon the what type of scar is formed. if we consider the types of scar of the skin, we can categorize it: the ice pick scar, rolling scar, and box scar. So, what is ice pick scar? Ice pick scar is a very fine scar, deep seated, and box scar is shallow. But rolling scar is shallow, but box scar is smaller but a little bit deeper. It can be all this can be seen in the same face, but sometimes maximum case we get all this type of scar in the same patient. So the treatment may be of combination. What the combination treatment we give, actually some surgical procedure, what we say subcision. Subcision is the procedure we give when there is a box scar and rolling scar, and this can be well treated by subcision. But TCA and TCA cross or TCS tricyclic acetic acid application is best for the ice pick scar. This can be given at the same time. We can use platelet plasma and by some micro needling or a derma roller, and all this can be given step by step. We can use other laser for the improvement of the acne scar of the face. This
Thank you very
actually
much,
this
sir.
depends.
We have
I want to add. Actually, this depends upon the patient's condition. At the same time, the dermatologist's choice. That what whenever dermatologist, any dermatologist have got different dermatologists have got different approach of treatment. This differs according to upon the dermatologist approach and feasibility, and at the same time the patient expectance and patient's ability to have this all kind of treatment available in Bangladesh.
right, sir. Thank you very much. We have learned many of the procedure name, but if I want to know about the cost, because this is very important, what you have added at your last sentence, the ability of the patient to bear the cost. So, what about the cost of these treatment procedures?
Costing actually depends whenever the patient, why the patient is getting the treatment, because the costing actually not only the physician, at the same time the surrounding expense of the surrounding situation is also important, because uh, in a corporate hospital it is expensive, or in normal hospital or in a personal chamber it is less expensive. At the same time the procedure the patient the doctor is choosing, laser is a
So
little bit expensive.
if I want to interrupt you, sir, if I want to interrupt you, that these advanced treatment procedures are available in all over the country. Is this so, sir?
Almost maximum is now available in Bangladesh, and all our colleagues, juniors and seniors, are using to some different kinds of these available treatment for the patient. So it is a gift from Almighty that all the treatments are available in Bangladesh. So it depends upon, actually the costing depends upon the
Obviously,
person
and this is a
or
very good news for our viewers.
indeed. So anybody in contact with a good dermatologist, he may suggest all the opportunities are not available in one center. He may suggest or he may refer his colleague, or I personally do one kind of treatment, but other kind of treatment I don't use. So if anybody wants to have this that other kind of treatment, I refer this patient to my colleague who is doing this treatment. So this is actually the good understanding between the patient and the physician, and at the same time honesty on the part of the patient and honesty on the part of the physician.
Obviously, and obviously, a good referral system should be established, and I hope that that is obvious in our health sector. Good referral system. So this is a very good information for our viewers. There are lots of viewers in our comment box. They're commenting and they're questioning. They have their queries. So Muhammad Oliullah Olive. he has two questions related to acne scar. Question number one: can acne scar be removed naturally? And question number two: can patient get rid of deep acne scars? What would you say, sir?
Okay, thank you for your nice question. Sometimes body has got some remodeling capacity. It's the body's natural um, response to any injury. So acne scar can be removed spontaneously. At the same time, if it is not removed spontaneously, we have got a lot of scar removing options already I have told. So you can take any of the options available nearby your facilities by dermatologists.
Thank you. Hope that you have got your answer, Mohammad Waliullah Wali. And Al Noman have questioned, how can we get rid of black spots after acne? What did you say, sir?
Black spots may be of different types. It may be open
Yes, sir.
comedon or at the same time post-inflammatory hyperpigmentation. Whenever any dermatologist look at the face, he can diagnose whether it is open comedon or post-inflammatory hyperpigmentation. If it is open comedon, he has to get some retinoids. At the same time, comedo extraction can be done, so it will be removed permanently. But if it is post-inflammatory hyperpigmentation, then he has to give some retinoids, other keratolytic agent like kojic acid, azelaic acid. At the same time, mild steroid can be added with this agents I have already told. So this is the decision of the dermatologist. What is the cause of the black spots? Then he can give treatment accordingly. Thank
Thank you very much, sir. And I want to thank our today's sponsor, Catalysis, and our today's knowledge partner is our today's knowledge partner is Cicatrix. And one viewer of us has questions about the Cicatrix cream. What is its benefit? And the patient Steve Mollick, he has questions, Bijan BP, he has questions about how much effective the cicatrix cream in acne scar. The patient is suffering from almost 1 year. So what will be your answer, sir?
you. Acne scar is a silicone based silicone based cream. Uh, this type of cream can be should be used just after treatment of the acne. But old case it is less effective. But it can be effective if it is combined with other modalities of treatment uh, like microneedling or derma roller. If derma roller and microneedling is given, is used, and after that, if he or she is given cicatrix cream, it helps. But a sole cicatrix after a long duration of acne scar is not very much effective. But it is effective with when it is given with some other modalities of treatment like derma roller and microneedling.
Okay, so Steve Mollick, he has big acne scars on his face. What cream he can use to remove his scars? He wants to know, sir.
Okay, thank you. This is if the scar is of old age or long duration of, so he has to have some procedural intervention, then he can be given any cream. But I have already told the long term or long duration scar cannot be treated with only cream. This can be treated with some other interventional procedure like uh, uh, chemical peeling, derma roller, microneedling, or laser. But isolated cicatrix or something like this for old scar is not very effective.
Thank you very much, sir. If I want to know about the follow-up procedure, what will be your answer? What are the follow-up techniques, and
Follow,
how is the yes, sir. Yes, sir. Please.
follow-up technique regarding the treatment, if I go back to basic of the acne, follow-up treatment is the first he has to um, um, You have to get in touch of a good quality dermatologist, and accordingly the dermatologist he should follow the advice of the dermatologist. First of all, being a dermatologist, I want to
Thank
say
you.
that you have to complete the full dose of the treatment the doctor prescribed. Then see whether there is the post acne complication like scar or hyperpigmentation. If the scar is there, then the patient should have intervention and other cream like cicatrix. So the patient should be in touch of the dermatologist. At the same time, the other thing what he is using, the like the whitening cream, he should avoid the excessive exposure to the sunlight. He should avoid, and he should lead a decent life, so that the circadian rhythm should be maintained. So the hormonal balance should be can be maintained. So all this must be in consideration. At the same time, if he has got some secondary disease like polycystic ovarian syndrome, other hormonal imbalance, something like this, that should be treated, and that should be he should have some consultation from other discipline like endocrinologist or gynae specialist. So all this must be in mind, that what are the disease, and the follow up should be accordingly, and that should be done by the good quality dermatologist, and at the same time patient must comply with the advice given by the dermatologist.
Bijon BP has questioned, can I use cicatrix in the session gap of the procedure? I think he is telling about the cicatrix cream, or what session gap. Sir, can you please answer the question?
Yes, cicatrix you can use just after using the procedure. Whenever you are getting the procedure today, you can use it tomorrow or day after tomorrow. The in between, but procedure is not every day. Procedure is to some extent 21 days after or 1 month after. In between, you can use the cicatrix to help the remodeling of the collagen or fibroblast uh, to remove the scar. So this is in between, but the procedure is 1 month interval or 21 days interval, but you can use the cicatrix in between the time. Okay.
Thank you very much, sir. Hope that Bijan BP, you have got your answer elaborately. And thank you for being with us and commenting in our comment box. Ajay Dash, he wants to know about the cost of chemical peeling, sir. What would you say?
Chemical peeling, what I have already told, that it depends upon the scenario or the place where you are taking this chemical peeling, and at the same time the what chemical he or the physician is using. Actually, it is not so much. Um, um, in my chamber, I use chemical peeling monthly, and that is 1,500 taka to 2,000 taka monthly. But in other center it may vary, because the cost only not depends upon the physician. It depends upon the surrounding situation, because whenever it is given in the corporate level hospital, it will be a little bit much higher. But if it is given in the other chamber, something like uh, other chamber, it may be different. So it depends upon the where you are getting the treatment and what are the chemical the physician or dermatologist are using.
Thank you, sir. Steve Mollick has said that he has big acne scars on his face, and what cream he can use to remove his scars. He wants to know.
Thank you. If already I have told, if it is the old scar, no cream will help. If it is old scar, no cream will help. But if it is new scar, you can use the cicatrix cream um, twice daily. New scar, but that is 1 month or 2 months, within 1 month or 2 months after the complete clearing of the acne, then you can use it. But if it is old, you have to use it with some other interventional procedure like chemical peeling, microdermabrasion, and microneedling, radiofrequency microneedling, and laser. But at the same time, if it is big enough, you can have some substitution type of procedure, but you have to consult a quality dermatologist who is expert in this kind of procedure I have already told. But you yourself should not have some intervention or something to do, because once it is disturbed or when it is destroyed, you cannot get it back the same one. So I think you should have consult a good quality dermatologist nearby. Thank
Thank you very much. So one of our viewers, Liton, he wants to know, are the acne scars completely removable or not? What should you say, sir?
you. One thing I want to say, that completeness is means 100%. Is it
Yes,
100%?
sir.
100%. Nothing can be back to 100%, but almost 100% we can get. At least 80 to 90%, we can give you the 80 to 90% of your previous skin if you come to the doctor very early. But late, if the time is passing, the success is reducing. The time is passing, the success is reducing. So if you come early, we can give at least 80 to 90%. But if you are fortunate enough, and at the same time the doctor is fortunate enough, you can get almost 100%, 90%, 95, 100%. I have got, fortunately, few some I have got some patients who got their treatment almost 100%, almost 100%. Because when they come to me after follow up, she told that I have no problem in my face now. So this is fortunate for this depends on the luck of the patient, at the same time luck of the physician. So, and at the same time, common thing is that you have to come earlier. The delay is the treatment, the reduction is the success.
Correctly said, sir. So we are about to end, sir. If I want to have some advice for our viewers, what would you say? Do you have any advice for our viewers?
Yes, I want to say all the viewers that, because this is a beauty problem, so don't be over enthusiastic about your beauty. The beauty concern is related to the dermatologist, and you have to consult a good dermatologist and abide by the advice given by the dermatologist. Never use the product available in the common market, and this is never take medicine from the chemist. Whatever you take a treatment from a dermatologist, because dermatology subject is now very much enriched in Bangladesh. A lot of good quality dermatologists are practicing whole the country now. So you will get dermatology nearby you. You just keep in touch with the dermatologist, and you will have a very good quality, acceptable, well attracted face, inshallah.
Inshallah. Thank you very much, sir, for your valuable opinions and your valuable time. And dear viewers, thank you very much for being with us and for commenting in our comment box. And I want to thank our sponsor today. And dear viewers, you will be with us, I know. I want to end our today's episode, and please be with us for the next episodes. Thank you very much. Assalamu alaikum. Good night, everyone.